Okay, so what we just did is we cleared the master point, which basically was inhibiting me from even accessing her nervous system. So I liken it to a firewall. So I wasn't even able to kind of access remotely through a muscle reflex test. So now we can. So now we can proceed into a treatment. Okay, so
Cool.
so hold here. This should weaken, and it does. So now I know that I can proceed. Okay, so now we're going to go to the jaw. Okay, so I'm going to bite down and hold that. Okay, keep biting and hold that. And hold that and hold that. Okay, so I'm just kind of cross-referencing it to some things. Okay, open your mouth wide. It'll be hard to do with the mask. Okay, so okay, now take your hand and place it on your jaw.
While it's closed?
Yeah, or just where it's
Okay.
relaxed, right? And hold that. Okay, something's going on just by putting pressure on the jaw. Okay, so keep it there. Remember, cross-reference it. Cross-reference it. Keep holding. Keep holding. Also, going to go to the neck. So hold here. Hold. Hold. Hold again. Okay. I'm going to touch the diaphragm
Okay.
area. And hold that. No. And hold here. Hold here. Okay, take your hand off and hold that down. Only push. Okay, so there's something going on there. We don't know yet what it is. Okay, so put your hand there
Yeah,
again.
that's where it's tight.
Yeah. Okay, so hold that. Hold it again. Okay, something is muscle. So we're just gonna try with some muscle. So try this. Put your fingers right at the jawline. Okay. Now I'm going to use a different muscle since she's using both hands. So I'm going to use the leg. Okay. So hold your leg in.
Hold it in?
Yeah, and I'm going to push away. So I'm just doing another muscle test. Okay. Okay. Bite down. Okay. Now because she's wearing a mask, I have to trust that she's doing what I'm asking her to. Okay.
I know.
Okay. Open your mouth wide. Okay. Hold that. Okay. Bring your jaw forward like an underbite. And then back. Like an overbite. Okay. And then to the side. And hold it. And the other side. Okay. And then just chew slowly. Okay. So that's not really showing anything either. Okay. So we're just gonna palpate. So come lie on your back. There's a lot of tension in the neck.
Yep.
A lot. All right. And in the jaw. Okay. So let me try some muscle testing again. So hold this arm up. So I'm going to push. I'm going to feel the diaphragm. Hold here. Okay. Back of the neck. Okay. And then hold here. And hold here. And hold again. And hold again. Okay. So it's muscle. So there's muscle involvement. So the first thing we did is access the system. The fascial system was a neuroemotional technique. Now what we're going to do is we're going to use ART, or active release technique, maybe some other techniques, to see if we can just loosen some of the constricting muscle. So I'm going to drop this down a little bit. And here we go, right in here. I'm just going to shorten it, hold it, and then lengthen it. So we're just doing a little bit of ART, just to release. Some neck postural muscles. And so depending on the muscle, I'll be doing different positions, different movement patterns. Yeah. And even in the front,
Mm-hmm.
here, okay? So, front muscles, they're coming back. That's the longest colli. One of my favorite muscles just because of the name. Okay. Alright, so hold here. Hold this arm down, I'm gonna push. And so I'm just getting feedback again, I'm just putting pressure into muscle groups. Okay, so now we're going to go to the masseter muscle, which is the strongest muscle for its size in the body. Okay, I'm just going to hold here. I want you to open your mouth wide and then close. Open and close. Open and close. And open. Close. Close. Open. Close. Open. Close. Open. Close. Okay. So try that. So hold here. And then push. Good. Does that mean it's fixed? Not necessarily, but we have raised the threshold so that it's not showing up in a muscle test, which tells me we're going in the right direction. Okay, so hold here again. Okay. Now, I'm going to go back to the diaphragm muscle, so hold here. Good. And hold. Hold this arm up. Yeah. Okay, that's good. Okay. Why do I keep going to the diaphragm? It's because it's so central to stress response. We tend to breathe shallow and everything collapses, which basically tightens up the jaw and the neck. Okay. Now, since you're a singer, you know perfectly well how to work from the diaphragm, but it's still a stress response.
Yeah.
And it happens to the best of us. Okay. So I'm going to have you come lie face down. I'm going to just check your upper back too. Okay. So now I'm just going more into general